As Hurricane Irma approaches the United States, Southeast Florida's health system is mobilizing for a surge in demand for medical care. More than 1 million Floridians have been told to evacuate from the path of the storm. At least 11 hospitals are being evacuated. Health officials warn residents to take action now to avoid an emergency. Our Dr. David Agus is here. Good morning. So we know Mercy Hospital, Miami, evacuated 200 patients, and over 140 health facilities in Florida now closed. What are the implications for people who need care?
Well, first of all, to get a patient out of a hospital into another state is very difficult. You have to go by ambulance and air transport or military transport, and you're talking hundreds of patients. And then 7,000 patients a year visit a day visit the emergency room in southeastern Florida. So these are large numbers, and when hospitals are closing, care is certainly limited. So people need to get out of the state.
So what's the recourse for people who need electrical equipment?
Well, that's a key one, is that, tens of thousands of people, the estimate is 20,000 people in the area, are dependent on electrical equipment for their daily life. That is oxygen generators, dialysis, and others. And that's obviously not going to be there as the storm hits the shore. So those people need to get out. And the problem is transport. If you're on oxygen and it's going 10 miles an hour, you're trying to drive from Miami to Georgia, it's impossible to do. So this is a very complicated procedure where they're going to need medical transport, and that's what's happening now.
I just wanted to show this scene because it happened yesterday at a Lowe's where a woman had driven 30 miles to get a generator. There were no more generators left, and this man who she didn't know said, "Here, take my generator."
Right.
But and they just embraced and hugged for a long time. She was incredibly emotional. It just brings home how dependent people are on electricity for their care.
Right. And then, the key thing is now, take your medicines, put them in a Ziploc bag, and take them with you. You need weeks of medicines. All too often, people go for a day or two supply, but if this goes on longer, like we expect, you need your medicines there. Pharmacies are opening up across the country and allowing prescriptions to be written. It's really critical that you take your medicine.
And technology is really helping as well. Telemedicine in particular. You were treating patients during Hurricane Harvey. Talk about that and talk about what we can expect to see out of Florida now.
Well, it's exciting. Many of the telemedicine companies have stepped up and they're offering their services for free to patients who live in the southeastern Florida. During the hurricane in Texas, many doctors, or several, called me and said, "I'm trying to get my family out. Can you deal with my patients?" And I had a list of phone calls, and 24 patients, I called them on the phone, helped with their medical care, and was there for them because doctors, nurses, emergency care physicians, they have families too. They have parents, they have children they have to take care of. So it's very difficult.
And we're seeing how useful some of these apps and technology can really be.
Fantastic.
Dr. Agus, thank you so much for joining us.